Welcome to the Sacred Window podcast. Here, we look closely at the intersections of the postpartum window, the Ayurvedic perspective on health and healing, and the universal mother principles that are the keys to giving and receiving effective care. Hello, I'm Christine Eck. I'll be taking you through interviews with professionals who are making a profound difference in the lives of their clients, conversations with individuals brave enough to share their stories of vulnerability as a way to lift up others, and my own journey through birth, parenting, caregiving, and building a conscious business. We are here to honor the sacred windows, the profound transitions in life that give it all meaning. Welcome to the conversation.
And I will never be the same again.
Okay, welcome everybody. I'm so happy to be here. My name is Christine Eck. I'm the director of the Center for Sacred Window Studies and the Postpartum Care Collective. Welcome to our enrichment talk for today with the wonderful Ashlee Sakaishi Wilkin. I'm going to introduce the Postpartum Care Collective and introduce Ashlee, and I'm going to pass over the reins to her. This talk is brought to you by the Postpartum Care Collective. We are an online presence, a community for caregivers who are passionate about postpartum care and offer services. We are directed towards growing awareness for postpartum care, growing a reach of people who are able to connect with families to connect with caregivers, and of course to create ongoing, continuing education for those in the field and supporting each other through this work. Ashlee is one of our instructors at the Center for Sacred Window Studies. She teaches cooking for postpartum. Ashlee and I have been teammates here for a few years now, and it's just been amazing to grow with her and see her go through pregnancy and postpartum and integrating her own experience into her teaching. And so Ashlee, welcome. I'm going to turn it over to you, and you can add more about your background as you feel ready to. Thank you so much for being here.
Thank you, Christine, and thank you everybody for being here as well. I am excited to, let me make sure I'm excited to be able to share. Christine, I just want to make sure that we're recording. Okay, cool. So I just wanted to say, first of all, I'm really excited to share this enrichment talk with you about cesarean recovery, because I feel like for myself as a postpartum caregiver and practitioner that I had, until I experienced a cesarean myself, I didn't quite understand what a cesarean itself was like, and also what the recovery was like, and how if I had known more before, how I would have adjusted my caregiving for my previous clients that had had C-sections, that had cesarean births. So my goal is for you to learn from my own experience, and I'd love to hear also if you all have your own experiences with C-sections, either personally or with clients. Like at the end, I'd love to hear any tips or hints or thoughts that you have that would be supportive to other Ayurvedic postpartum caregivers or just caregivers in general. So welcome aboard. During my talk, I would be happy to answer questions as they arise, whether they are typed into the chat or if Christine reads them out loud, if they arise and need to be addressed at this moment in time. And I will also do my best to leave space at the end to answer questions if there are questions. So let's dive right in. Like I said, my intention is to provide you with practical information to support your cesarean birth clients using the Ayurvedic lens and Ayurvedic principles. And I have this picture of a lazy boy here because a lazy boy that looks very similar to this one, not amongst all this stuff, but very similar looking to this one, was one of my saving graces during my postpartum recovery. And I would never have thought to have either purchased or found a lazy boy chair, but it was invaluable when needing to get up and down, because that was one of the things that was painful for me. So I'll talk about that a bit more later. This is a picture of my little guy, Cedar, who was born in January of 2019. And this picture was taken shortly after I was wheeled into recovery. And so I didn't have to go under general anesthesia. I had a pretty intense labor experience of induction, and it was a 4-day long experience. And I got to push, but he wasn't coming out. So ultimately my birth ended in a C-section. And while that wasn't at all what I wanted to have for my birth, having gotten to try everything leading up to the actual birth experience, I felt really good about just getting him out at that point. And I also had the opportunity of witnessing a cesarean for a labor doula client about 2 or 3 months prior to going into labor myself with my son. So I was also a little bit more mentally prepared for what was going to happen when we went into the OR. That being said, the experience in my physical body was really intense. And so the process of cesareans is an intense major abdominal surgery. And there are some things that I think would be helpful to have known ahead of time to prepare myself even better. And so different ways that we could bring in Ayurvedic principles to hopefully help alleviate or remedy some of the excessively increased vata and excessively increased cold quality that comes along with a C-section. So hopefully I'll be able to express that to you all clearly as we move through this talk today. So for those of you who have studied with us here at the Center for Sacred Window Studies, our program is built around the concept of mother principles, which this is the list of mother principles: love, simplicity, compassion, flexibility, non-judgment, community, intuition, and listening. And the application of these principles are the guiding light for all of our care as we work with clients, and also as we're helping them to prepare for their labor, their birth, and their postpartum. Now, during the postpartum window from the Ayurvedic perspective, there is a natural increase in vata dosha. And this is with however the birth ends up happening, whether it's vaginal or whether it's a cesarean birth, vata dosha is going to get elevated. So we're likely to see impaired agni and elimination, an increase in dryness in the body, an increase in coldness in the body, a very expanded state for the individual and for their family. We're likely to see a birther who is sensitive to sensory stimuli. And we're also going to see a lot of huge body adjustments. So there's going to be more space in the abdomen once the baby is birthed. There's also going to be a huge shift in hormonal changes, and that's also going to increase vata dosha. So this is just some basic kind of signs or symptoms that vata is being increased in the body. And it's important to keep those in mind as we begin talking about surgery, because you'll see the qualities of vata, which are cold, dry, rough, hard, are going to be increased as we step into the OR room, right? We're going to see more of that cold, dry, kind of hard quality present in the OR. Now, I'm not going to be showing you a video of what happens with a cesarean, but I would like to kind of relatively graphically describe what happens in a cesarean so that you have an understanding. Now, if that's something that you feel like you are not wanting to listen to at this point in time, if you are easily made queasy or something along those lines, I'll wave my hands like this when we're done talking about the actual process and procedure of a cesarean, and then you can turn your volume back up. Sorry, I won't go quite into that yet. I have a couple more slides, but then I'll start talking about what happens with a cesarean. So, like everything within the context of Ayurvedic medicine, there's a time and a place for everything. There's a time and a place for every circumstance to play out. And for many birthers, they might end up in an emergency cesarean, or they might end up with medical conditions that lead to the necessity of a C-section. It might not be their first choice. In those circumstances, birther might need to process their birth being different than they planned it being. And then there are other birthers who are going to say, choose a cesarean for whatever reasons they choose a cesarean. Now, there's no judgment, right? Non-judgment is one of our mother principles. So however the person decides to have their baby, we as postpartum caregivers are just holding like that sacred space around them and honoring and supporting them as they process and transition into becoming parents. Like I mentioned, all birthers will experience an increase in vata dosha. They also might experience additional doshas in a state of increase, depending upon what state the doshas were in their body prior to going into birth. They're also going to have a greater chance of impaired agni. So with C-section, impaired agni is going to be more likely. They also are likely to experience constipation because of the pain meds, the antibiotics, and the general like trauma to the abdominal region that will happen in a cesarean. And they're also likely to have digestive symptoms and a longer recovery time, and potentially like other aches and pains in their body where the uterus may be impacted in a different way just simply due to the process of surgery. We also might see that they could have complications in regards to their incision site. So either an infection or a seroma or a oozing site, so it's not closing properly. And so there's some things that we can do as postpartum caregivers to support that healing and making sure that they're getting the appropriate food during that time. They're also going to be experiencing a heavier foreign substance load, meaning that the amount of potential medications that they may receive while in the hospital might be higher, especially in comparison to somebody that's, say, having a home birth. And so their body's going to have to be processing and eliminating those like toxins essentially out of their system in the immediate postpartum window. They're also going to be having a greater nutrient needs due to the tissue repair that needs to happen. And so it's going to be different than, say, like a vaginal tear, because a vaginal tear, yes, there's going to be tissue damage that needs to be healed. But with a cesarean, instead of it just being like the perineum and potentially the cervix, it's the entire lower abdomen and the uterus and the fascia. There's like all of these different layers that has to be cut through in order for a baby to come out into the world via cesarean. And so again, ensuring that there is adequate nutrition to support the regeneration of those tissues is imperative for a cesarean birther. So it can be a challenging time for somebody who is a vegetarian or vegan during postpartum recovery, because literally they will not have the building blocks, the amino acids in as great of abundance if they're only eating vegetable, like plant sources of protein. Their body's going to have to work harder to pull out the amino acids that are needed versus having bone broth and collagen protein as the building blocks for their tissues. So we'll talk about that a bit too. Okay, so now I'm going to start talking about the actual process or procedure of the cesarean birth. So if you're not interested in hearing what happens exactly, you can like turn off the volume or mute, and I'll again wave my hands to let you know that I'm done talking about what happens. So a cesarean birth is a surgical birth, and it typically happens or takes about 60 to 120 minutes from start to finish. So from the moment of incision to being wheeled into recovery is about 60 to 120 minutes. So 1 hour to 2 hours, depending on the circumstances of the cesarean. Now, cesarean births start out with surgical preparation. And so typically this happens prior to going to the OR, and depending upon the hospital, it can happen either in the birthing or labor rooms, or it can be in a like pre-operation region of the hospital. And so what happens during this time is that an IV is administered if it wasn't administered already. An anesthesia is given. So typically most hospitals now do a local anesthesia or a local anesthesia where they do a spinal block. So they'll literally insert a catheter into the spine and administer a strong dose of narcotics and pain relievers and anti-inflammatories. And the actual composition of the anesthesia is dependent upon the hospital and or the anesthesiologist. So it's hard to know exactly what the cocktail is that's used in the anesthesia for a cesarean. But that's administered, and or there could be general anesthesia where the person is unconscious during the cesarean. Most hospitals are moving or have moved to having the spinal blocks instead of the general anesthesia, because then the birther is awake and there's less potential repercussions for the birther and the baby. A catheter also is inserted into the urethra and bladder of the birther, and the pubic hair is typically shaved or clipped on the upper part. So like it's not completely removed, but the about 2 inches below where the pubic hair starts is typically shaved or clipped off. In some hospitals, they'll also give an anti-nausea medication, which helps to reduce the potential of the birther getting nauseous and vomiting. So it basically like stops digestion in the stomach. And so that's another reason why digestion, stops digestion in stomach acid. That's another reason why agni can be greatly impaired after a cesarean, is because of the medications that are given. Now, if the person has the capacity to do some Ayurvedic preparation prior to going into pre-operation preparation, then we could support our clients, especially if we're able to be in the OR with them or be in the process with them, by bringing in warmth. And so typically they're going to put the birther into a hospital gown if they weren't in one already. But ORs are notoriously very cold in order to maintain a sterile field. And so they can be very, very cold for a birther. So if it is allowed for them to have nice warm socks on and a nice warm hat, that can be something that helps to make sure that the birther doesn't experience the intensity of the cold from the OR. They can also see if they can have their own music, it's like their own sounds that would be soothing in the process of the birth of their baby. Now, some ORs or anesthesiologists or doctors aren't open to that, and some are. So it just depends. Like the support person might be able to have a favorite artist or favorite song playing in their phone in their pocket or something along those lines, where the birther is actually then able to take in soothing, like calming sounds through their ears instead of simply being in the sounds of the OR. They could also potentially talk with the nurses and then therefore the OR doctors to see if the conversations could be kept in check. So for some birthers, they might want just like either the doctors to only be talking about what's happening with the surgery itself, or to not have kind of everyday banter, which can happen during cesareans. So it's really dependent upon what the birther is choosing. Another thing that can be utilized is possibly homeopathic remedies might be used pre-operation in preparation for the operation. So arnica is really supportive and helpful for tissue damage and bruising and trauma to the tissues. Hypericum, which is St. John's wort, is really fantastic for nerve damage. And Staphysagria is really helpful if somebody's having a lot of emotional, if they're experiencing going into the OR as a really traumatic experience and they're really weepy, Staphysagria is really helpful. And then calendula helps to prevent infections and helped skin to heal. And so typically these homeopathic remedies would be taken 15 minutes apart from each other, and they would be taken away from strong tasting or smelling things. So some hospitals might be opposed to the person having these small sugar pills, but especially if you have some time leading into the preparation for the cesarean, the homeopathic remedies, or even just one of the homeopathic remedies, can be utilized. In the operating room, the gunas or qualities that are present, like I mentioned earlier, are especially the cold quality. There's also a bright quality to the space because the lights are really bright in order for the doctors to be able to see appropriately what they're doing, which is important. There's also a lot of movement, so it's pretty busy. There's a lot of people typically that are present in the OR room when a cesarean is happening. There's at least 2 OR doctors, there's surgery techs, an anesthesiologist, a mama nurse or a nurse, and a nurse for the baby. There's also a respiratory therapist, and there's potentially additional people that I'm not accounting for. In addition to the either one support person or 2 support people for the birther themselves. Now, typically, what happens is the birther is wheeled into the OR and they're put onto the surgery table, and they are, one of their arms, typically the arm that has the IV, is strapped down so that they can't bend their arm. And in some hospitals, the other arm is free, but not in all hospitals. So in some hospitals, both arms are strapped out. And the birther can ask for warm towel or warm blankets to be placed on the top of them if they're really cold. That can also help remedy the cold quality of the hospital room. There is antibiotics that are administered intravenously by the anesthesiologist, and the antibiotics actually burn when it goes in, and so that was something that I personally wasn't prepared for. They didn't tell me that it would burn, and I had no idea that that's something that would happen, but it burned when it went in. And then the doctors will start to check to make sure that the person is completely numb. And so once the birther is completely numb, they begin by making slow incisions through the different layers of the tissue. So they cut through the 7 layers of the skin. And typically the actual length of the incision is not super long. And what they tend to do is use a sharp instrument to start the cut. And then they typically use blunt instruments to then kind of tear the tissues in a way that it opens up wide enough for them to be able to get their hands in and bring the baby out. That also was something that I wasn't prepared for, because there's a lot of movement that happens in the process of them opening up the abdominal cavity in order to get the baby out. There's also a cauterization that happens. So they're cauterizing blood vessels and arteries as they're going through so that there isn't a lot of bleeding out happening. And so they cut through the skin, they cut through the adipose tissue, they cut through the fascia of the abdomen. And then they also potentially cut some of the linea alba, which is the fascia that runs down the center line of our body, which is this white fascia. And allows them to then spread the abdominal muscles apart so that they can get in and access the uterus. They then move the bladder out of the way, open up the muscles, and they get access to the uterus itself. They make a small incision on the uterus and again use blunt instruments to open the uterus up large enough in order for them to reach in, break the bag of water if it wasn't already broken, and then birth the baby out. Now, if the baby is really deep into the vaginal canal, they might have to, there's going to be even more wiggling and jiggling in order to bring the baby back out far enough so they can access the head and slide the head out first and then birth the rest of the baby. Now, once the baby is birthed, they generally clamp and cut the umbilical cord. Some hospitals are starting to do delayed cord clamping, but a lot of hospitals don't. And so they clamp and cut the umbilical cord, and then they birth or remove the placenta. They then typically will flush the placenta or flush the uterus out and then bring the uterus on top of the abdomen. So they bring the uterus out of the abdominal cavity so that they can inspect it and make sure that all of the placenta has been removed. And then they suture up the uterus while it is outside of the abdominal cavity. So there's this kind of tugging just in that process of bringing the uterus out onto the abdominal cavity. While they are stitching up the uterus, typically the baby is being cleaned off, and then maybe the baby is brought over to the birther, and the birther is able to see the baby or have the baby set onto their chest. And that's the most ideal, right, for the birther to be able to have that immediate, skin to skin, being able to see and smell their baby and talk to their baby. That's the most ideal. Once the uterus is sutured up, the uterus is put back in, and then the doctors go through the process of suturing all of the different layers that they had previously cut into. So there is the layers in the uterus, and typically there's at least like 2 to 3 layers of sutures within the uterus. Sometimes just one, but that's not as strong, right? So ideally having at least 2 layers or 3 layers of sutures in the uterus is more ideal for maintaining the strength and integrity of the uterus itself. And then there's the fascia, and there is the skin, the different layers of the skin. Now, the skin itself can either be sutured up with sutures, with the dissolvable sutures, or they can be either stapled or glued. So the very last layer is a staple or a glue process. With the staples are typically removed prior to leaving the hospital or within 3 days of the cesarean birth. Glue just disintegrates eventually. With all of these, with the staples and with the glue, there's always like some steri-strip, some tape that is put over it as well, as an additional way for the body to be protected. And so I'm done talking about the kind of logistics of the surgery itself. Once the surgery is complete, depending upon the hospital, the birther is either taken to their postpartum room or they're taken to a post-operative, like a transition location. And sometimes the baby is able to stay with the birther, but not always. So sometimes it's just only the birther that is able to be in the post-operative recovery, and the birth partner or the potentially doula is then with the baby in the recovery room waiting for the birther to come back in. So generally, if we are able to be with the birther during the post-operative stage, we want to make sure that the birther is really warm. And so ensuring that they have lots of warm blankets on them. And during this time, their vitals are checked very frequently, and they're being monitored by the post-operative nursing staff. But the more that we can allow skin to skin with the mom and the birther, or the birther and the baby, the better. And the more we can keep the birther warm, the better. Now, if we have the potential of the birther being able to take homeopathics, and the homeopathics can either be administered on the tongue, or you could even put it onto their fontanelle. So using a little bit of their saliva and placing it onto like the birther's fontanelle themselves, that can also impact the birther's system. So you can again use arnica, hypericum, calendula, or staphylos aureus.
Hi, Ashlee. I'm curious. I know that some procedures, like emergency versus non-emergency cesareans, and the time, of course, that it takes to do that is pretty different. What are your thoughts on that? Just, I guess, in terms of like the time difference and any changes or any differences.
Yeah, I think so one of the things that I don't know if I mentioned is that from the moment of the first incision, typically the baby is born within 5 minutes of that first incision. So it happens really quickly that the baby is brought out. But then the rest of that time is typically like making sure that everything is okay in the uterus and that they've gotten all of the gauze strips out, and double checking and triple checking to make sure that the uterus, all of the placenta has been removed. There's no like parts of the amniotic sac that's still retained. Typically with a emergency cesarean, it's going to be faster. Like the pre-operative stage is going to be faster because time is of the essence. Now I'm not sure, like it depends of course on the situation, if the actual surgery is longer for a emergency or if it's not as long, if it's shorter for an emergency because they're trying to get in and get the baby out. I do know that sometimes they will do a general anesthesia for emergency situations because they might not have time to have the birther lean over and do the spinal. So they will knock the birther out so that they're unconscious for the birth. And that I think is probably the most predominant difference that I've heard and read in regards to emergency versus like imperative for the baby to come out via cesarean, but not an emergency situation like life or death. So this is a listing of all of the different medications that are utilized. So before surgery, there might be anti-nausea meds, possibly a medication to stop contractions if contractions have been happening, IV antibiotics, of course, fluids with the IV antibiotics, anesthesia. And then during surgery, there will be potentially the continuation of anesthesia. After the baby has been birthed, they pretty much across the board, most hospitals are routinely going to be administering Pitocin to prevent hemorrhage and to help the uterus to clamp down. And then post-operatively, there is going to be some form of pain medication. And so in some hospitals, they might use a high dose of IV acetaminophen or Tylenol. And kind of the pro to that is that then the birther doesn't have opioids in their system. So they're able to be more present and awake with their baby. And or the person may have the opioids in their system, which can impair their capacity to be really present and to have that golden bonding period or golden bonding hour with their baby, and or just make them a bit woozy. Now, the anesthesia itself will have some narcotics in it, and so a birther might still experience some of the side effects of the narcotics, like itchiness or flushing. Those are the most common, is itchiness or flushing. But so generally pain, post-operative pain medication is either IV acetaminophen followed up by ibuprofen or like opioids that are utilized. And then the post-operative pain medication typically is utilized for the following 10 to 14 days. And because a cesarean is a major abdominal surgery, pain management is incredibly important. And so while I think a lot of people, especially that are more naturally minded, would opt, if they had an option, to not take medications, during this time, it's actually really important for their healing to ensure that their body is not in a state of stress. So they can utilize the Tylenol and ibuprofen that's recommended, or they could use the potential like narcotics, hydrocodone, or other more intense narcotics, whatever they need to do in order to be in a state of relative comfort so that their body can do the healing is really important. In addition to that, we can utilize natural things to help support their body's natural healing mechanism, which is where I think Ayurvedic postpartum care can really, or nourishing postpartum care can really shine and be supportive to somebody experiencing a cesarean. So typically a birther is going to be staying in the hospital for 3 to 5 days following a cesarean. And during that time, one of the things that I found to be super amazing and helpful was that the, sorry, I think I have a different, the hospital bed moves up and down, and it has these really great rails. And so as somebody that experiences major abdominal surgery, one of the most challenging things can be, and most painful things can be, sitting up, even if you're doing it in a way that's supportive, either with people that are helping you to get up or using something else that's helping you to get up. But anytime we are getting up, it's almost impossible to not use your abdominal muscles even a tiny bit. And so that was incredibly uncomfortable to get up and down out of bed once I got home and didn't have the hospital bed. So those 3 days that I was in the hospital was really wonderful because I could just press a button and it helped me sit up, and then I could easily slide my legs off the bed and get up. Now they recommend I have to back up a little bit. So once the birther is wheeled into their postpartum recovery room where they will be for the next 3 to 5 days, they are not allowed to have fluids unless it's like ice chips or tiny, tiny sips of water. And they're not allowed to have food for 8 to 12 hours. And so that's the intention, is to prevent them from getting sick and vomiting, feeling nauseous. And so what I recommend, if possible, instead of having ice chips or instead of having sips of cold water, is for them to have sips of something warm. And that could be sips of bone broth, or just sips of freshly boiled hot water, or like a digestive tea to support their body, to support their Agni and support their body, reducing vata dosha and supporting the formation of Agni, or the kindling of Agni. A lot of hospitals will leave the catheter, the bladder catheter, in the birther until the following day. And they'll oftentimes put these compression like casts on the legs of the birther. And so that's basically causing this kind of like gentle lymphatic massage for the legs of the birther to ensure that the lymph is still moving and to prevent blood clots. And I found those to be actually quite lovely. So it's like having a little massage on your legs all the time. So that is there. One of the things that we can do if the birther hasn't yet taken any homeopathic remedies is to administer homeopathic remedies once they get into the postpartum recovery room. Now, we also, of course, want to make sure that the birther is doing as much skin to skin as possible with the baby, both for their own health and healing and for the baby's health and healing and well-being, and also for them to have that moment and that time to bond. So the more we can support that, the better. And part of the ways that we can support that is ensuring that there are enough pillows and other things to nestle the birther and the baby into a comfortable position where the birther doesn't have to like hold their body up, where they're leaned back in the right way and have the right amount of pillows behind them and the right amount of pillows under their arms so that they can just simply be with their baby. And they typically aren't going to feel their incision for a while until the anesthesia from the spinal wears off. Now, after the first 8 to 12 hours, the nursing staff is going to start to recommend that the birther starts to walk around. So once the catheter is removed, they'll suggest that the birther starts to go use the restroom and potentially walks around. Now, we, of course, want to make sure that the birther is getting as much rest as they need. And the walking is a bit important to ensure that there isn't blood clots that form in the birther's body. So doing some gentle walking to the bathroom and back every couple of hours can help to make sure that there isn't stasis in the body. Okay, so from a healing perspective, in addition to the homeopathic remedies, we can support the birther to begin to be in contact and connection with their incision. And this is one of the things that I wasn't aware of, that I learned actually through Innate Traditions postpartum training program with Rachel Saligas Garcia. And I loved this, and I wish that I had thought about this beforehand. But basically, from day one, the birther can start by getting their hands nice and warm and placing their hands over their incision. And so they don't have to lay their hands directly on the incision, which is bandaged up at this point in time, but they can lay it above it. So they don't have to put any pressure if they feel really nervous about that, but just simply like holding their hands, and the heat of their hands can be placed over their womb area, and or it can be their support person, either their partner or a postpartum caregiver, that then does this and just like sends the intention of warmth and healing and nourishment to the birther. And even just doing this right now, it feels good, and I can feel my nervous system kind of starting to relax. So if you can do this right now yourselves, rub your hands together and simply place them over your womb. And just notice the sensations that you might be feeling in that area. Is it different? Is it warmer? Is it colder? What does it feel like to you? So this can be a super simple, powerful practice that the birther can start from day one, immediately even after surgery, and they can continue to do this until they're ready to start doing abdominal massage or scar tissue massage over their scar. In addition to that, we of course want to make sure that our clients, that our birthers are really warm. So we want to make sure that they have some really nice warm socks on, that they maybe have a hat on or a scarf on and or a blanket, something that's going to keep them nice and toasty warm to help make sure that vata doesn't find a root in their body and really establish itself. We can also make sure that there isn't any drafts happening. We also want to make sure that they are drinking and consuming warm things only. So warm fluids, warm teas, as much bone broth as possible. And if not bone broth, then potentially collagen. There's like all of those really great like hydrolysated collagen powders now that can be utilized mixed into hot beverages or mixed into bone broth to add additional collagen to the birther's body so that they have those for cell and tissue regeneration. And we of course want to make sure that there is a good quantity of black pepper and or some ginger in there as well. And if the person, once they're able to eat again, is feeling hungry, then starting out with things that are light and easy to digest. So rice kanji or grain gruels with adequate spices that are on the soupier end are going to be much easier for the birther's body to process. And now we talk in our program about how when there's a cesarean, that the quantity of ghee or the quantity of oils that we'd be adding to foods is going to be a little bit less than it would be for somebody who has a vaginal birth. The reason for that is because of the kind of slippery quality of fat that then could potentially inhibit the strong connective formation of the tissues healing back together. So the protein of the bone broth and collagen is really what's giving us the building blocks to create that nice, strong scar, essentially, that is important for our bodies to heal appropriately. And having adequate fat is also important to help bring vata dosha down, but we don't want to have so much of an excessive quantity of fat that, number one, they can't digest it, because if their agni is impaired, they're not likely to be able to process a large quantity of fat because it's going to be a bit harder to digest. So starting out with like 2 teaspoons of added ghee to their bone broth is a good way to start. So they're still getting fat, but they're not getting so much fat that it's going to dampen their digestive fire. Basically, for the duration of the time that they're in the hospital, for those 3 to 5 days, having rice kanji or having some kind of gruel and bone broth or collagen and then digestive teas, that's what I would recommend basically for their diet is rice kanji, bone broth. They could have like a soup that has really soft meats added, like cooked into it, so that they can digest and they have that adequate protein, but keep it as easy and soupy to digest as possible. Now, we also want to support their agni. And so having all of those warm, soupy foods is going to support their agni, but we can also add either panchakola ghee or churna or simply black pepper to their food. And that will help to ignite the digestive fire and also help to kind of burn up any ama that might be forming due to the impaired agni and the increase of toxins. We also want to support elimination. And so for most birthers, they're going to be prescribed a stool smear, but we can provide stewed dried fruits with ghee and spices and potentially chia seeds instead, which will then provide them with an energy source and help them to have a bowel movement and provide some iron for them as well. And that will be like better for their body. It won't be introducing one more potential toxins for their body to process. And then, of course, we want to make sure that they rest as much as possible. So that's the first 3 to 5 days post-birth.
How are you sharing your gifts and passion for caregiving with others? In a world where education and awareness around the postpartum window is lacking or missing from our modern systems, we have a profound opportunity to shift that paradigm. You may be a few simple offerings away from making a truly impactful difference in the lives of mothers and families in your community. We are here to support your journey in the ways that work best for you. Schedule a conscious care strategy session to meet one-on-one with me, and let's identify the right next step for you to begin a path of conscious care for new families that fits your life and your needs. Visit www.sacredwindowstudies.com/strategy-session to schedule a time that works best for you. That's www.sacredwindowstudies.com/strategy-session.
Once the birther gets home after days 3 to 5, there are some things that I think are really beneficial to support postpartum healing for somebody that's had a cesarean. So, of course, having helping hands, and that can be somebody that's hired and or family members, but having more people to help take care of the basics around the house, as well as to help the birther get up and down from either a sitting or a laying down position. Because, like I mentioned, just that process of getting up is super uncomfortable. So, if the birther can cross their arms like this and hold on to a support person who crosses their arm like this, then they can just kind of brace their body, and the support person can help them to sit up. And they basically would be, bringing the birther up, and the birther doesn't have to use their stomach muscles. That still will cause a little bit of discomfort, but it's not going to be nearly as uncomfortable as kind of trying to roll to their side and push up and then get off the bed that way. So the more helping hands, the better. And anytime the birther needs to get up to use the restroom or to get up to do anything, having that help is hands down super beneficial. Now, I also highly recommend, like I mentioned earlier, having a recliner chair and a table nearby with everything that's needed, or a surface nearby that has everything that's needed, especially if the birther, for whatever reason, is going to be left on their own for a period of time during the day. If they can kind of set themselves up or be set up in a recliner chair, then they can lay the recliner back, and they could even sleep in it or rest in it, but they can also be supported to sit up using the recliner. So they're not having necessarily to rely on another person if that's not available to them. So the recliner chair, I think, is like mandatory for people experiencing a cesarean for easier healing. I also recommend high-waisted underwear, either the hospital underwear or other high-waisted underwear that won't rub on the incision site, because most of our underwear, which we don't realize unless you have a cesarean, typically falls right about on the place where the incision will be. And so having high-waisted underwear just makes it much more comfortable. And that will be up until the incision is fully healed and the sensations have kind of normalized a bit. Wearing high-waisted underwear will be beneficial. Now, some people like lower, so there are the really low bikini underwear, and some people like that, depending upon where the incision is on their body. It's also imperative that they have access to something that keeps them warm. So either a warm water bottle, a heating pad, or like a microwavable rice pack or an oven heating rice pack, something that they're able to apply on and over their uterus as much as possible once they get home. I also highly recommend using a healing skin and or tissue tea, like a sitz bath tea, to pour over the incision at the end of a shower or at the end of a bath once they're cleared for baths, and then to blot that tea with the towel instead of wiping over the incision. So typically, like once they leave the hospital, there will be these steri strips on and over the incision, but it's not going to be like a solid bandage that's over it. So the incision can breathe and or ooze if it needs to. And therefore you can then apply like a healing skin or tissue tea at the end of the bath or the shower. Now you'd want to make sure that the healing skin or tissue tea is warm when it's applied, so it doesn't cause a constriction or an increase in vata dosha just by the shock of the coldness of that tea. Wonderful healing skin and tissue herbs include calendula and sage, lavender, plantain, comfrey leaf once the tissues have, once there's no sign of infection. And there are a variety of other herbs that I'm not thinking of that could be utilized. Rosemary, rose itself can also be used. And so basically making a tea and then having that available to pour over the incision. If the person develops what's called a seroma, which is basically like a fluid-filled sac above the incision site, or it could be below the incision site, having a warm, wet compress using those healing teas, those antimicrobial healing teas, can be really beneficial to helping that seroma to release and also to helping the tissue to heal and prevent potential infections. Okay, so for food during the postpartum window following their arrival home, we would still focus on bone broth, collagen, and protein in the form of easy to digest soups and light food in general. And the quantity of food that the person eats should not be an excessive quantity, because an excessive quantity of food can dampen the digestive fire. So we are going to listen to the strength of the person's Agni and how hungry they are, and gradually increase like complexity and increase density. But we still want to make sure that this person has, that their food is light and easy to digest for the first couple of weeks postpartum. So our focus should really still be on soupy bone broth foods. We also want to make sure that the birther is drinking digestive teas and or drinking like the Sweetwater lactation tea, a light fennel fenugreek combination, or a light fennel tea. That's going to help support their digestion throughout the day, and that they're drinking only warm things. So those digestive teas, or freshly boiled hot water, or other herbal teas that are supportive to healing. They could also have like nourishing warm milk tonics if their digestion is strong enough. So the milk tonics can help to provide some protein and support for the body, while also calming their nervous systems down. And then I highly recommend a probiotic for the birther and the baby as soon as they're able. So if they're in the hospital, they could start taking a probiotic as well. But if they don't have access to that, then once they get home, starting to take a probiotic, and then also administering a probiotic for the baby. One thing that I forgot to mention about the preoperative stage prior to going into surgery is that if it's available, the birther can actually do what's called vaginal seeding, which means that you take a sterile gauze, and the hospitals usually, they won't go through this process for you, but they will provide you with the materials to do this. Typically, you take a sterile gauze and you insert it into the vagina, and you leave it in the vagina for 5 to 20 minutes. Or even if it's just sticking it in there and then taking it out, then that could be beneficial too. And then you put it into like the little pee vials so that it maintains moisture and it has all of the good microbiota from the person's vagina. And then once the baby comes out, you can swipe the baby's face and their mouth and their nose and their eyes, like you can put it all over their whole body with that moist gauze strip. And that's going to potentially, hopefully, have enough of the microbiome of the birther from their vagina that it'll help to seed the baby with the microbiome of the mother or of the birther. So then having probiotics can just help to further make sure that the baby and the birther have a healthy microflora in their gut and their GI system. And then I highly recommend also like a very simple either Velcro belly band, and they have like these gastric surgery belly bands that are it's just one like 12-inch elastic belly band that has a Velcro on it, and you can put it around your back and just bring the two sides together over the front. And that was the most comfortable for me. And I started using that on like day 5. So once I got home, once the staples were removed and I like the tissue had healed a good amount, I would put that over my body, and it helped to just contain everything. And it also provided me this feeling that the incision was protected a little bit more. And it also helped, like anytime I had to sneeze, I could like put my hands over it and just like hold the incision so that I didn't hurt my body when I sneezed. But there's something about that Velcro band that really helped to contain the space. And it's not as complex as like a long thing of cloth or the like more complex belly binding systems. It's also a little bit less constricting and easier to put on and take off, which when you're recovering from a cesarean, having more ease is better than less ease. I also found that having and receiving some gentle lymphatic massage to move the lymph, because I had a good amount of edema, to move the lymph of my legs and to release some of the tension from labor and from the immediate days of postpartum was really beneficial. So we wouldn't necessarily do like a full abhyanga or oily massage for our clients until their incision has fully healed. But in order for our clients to be more comfortable, and if we are doing touch as part of our practice, then helping their body to heal by just moving some of that excess fluids and helping to relieve some of the tension that might be built up in their body can be so beneficial for them to heal and to come back into their bodies. I also highly recommend different like flower essences to help facilitate the kind of spiritual transition and the processing of their birth experience during the postpartum window. So once the incision has healed and is closed, which can be, it happened a lot faster than I would have thought for whatever reason. But once the incision is healed and closed, there is a likelihood that the person might experience gas pains. And gas pains can be felt in the body like almost like sharp pains in their upper chest and upper shoulders and or back, because when they are sewing up the person, when they're completing the cesarean, there is some gas that they're not able to eliminate that is still in the abdominal cavity. And so that gas naturally moves up in the body. And so it can become apparent day 5 to day 20, day 10 to day 20, where they'll start to get this weird pain in the upper part of the body. The only thing that I've read that is effective at helping to remedy that is heat. And so taking a nice hot shower or putting a heat pack on those specific areas can help the gas pains to reduce. I also found these little silicone strips called Scaraway that helped to protect the incision from rubbing on clothes. And so you can buy those on Amazon and other places. And they're basically these silicone strips that can be reused, and they just get placed over the incision so that when you are wearing clothes, it doesn't rub on it. It's also said to help reduce scar tissue formation. I didn't use it regularly enough to see like a huge transition there, but just felt like it was helpful for reducing irritation. And then yeah, Charlotte says the sea panty has silicone strips built in. Yeah, those are great too. I had one pair of those, but they're kind of expensive, so I didn't want to buy multiples of those. And then belly wrapping, once the person is comfortable, if they haven't already started belly wrapping, of course, is going to be beneficial for supporting all of their tissues, all of their organs falling back into place, and their overall abdomen from being both stressed, but also from well, yeah, it supports just the healing, bringing the tissues together so that they can heal stronger. Now, we'd also want to make sure that they continue the laying on of hands, like warming their hands up, laying their hands on over the incision. And then once the incision is fully healed, to start slowly and gently, first just like touching the scar tissue, and then eventually slowly beginning to do some scar tissue massage. And I'm going to put together like a handout that has a link to a really wonderful video, and I'm forgetting her name right now, but the woman who has this video or created this video has an amazing multiple different programs for helping to support scar tissue remediation, as well as like pelvic floor health and healing. She's a pelvic floor PT. Because ultimately we want the scar tissue to be nice and strong, right? Initially we want it to be strong so that the tissues have strong integrity, but we don't want the scar tissue to become, once it's done its work, once it's healed and created a strong tissue, we don't want it to become like overly stagnant or overly stuck, because that leads to the potential of adhesions. So of the scar tissue connecting to other tissues or connecting to other organs of the body, because it's not being kind of worked appropriately. So starting scar tissue massage as soon as the person feels ready can be super beneficial. In addition to that, after about 6 to 8 weeks, or once the incision is fully healed, the person can begin to do castor oil packs. And so castor oil packs look like applying a healthy quantity of castor oil over the incision on a piece of fabric, and then putting a hot water bottle over that and letting that warm up the body, and allowing that castor oil, which has anti-inflammatory properties and pain relieving properties, as well as it helps to break up adhesions, to penetrate deeper into the tissues. And then continuing to do the scar tissue massage can also help prevent those adhesions happening. Now, moxibustion can also be used. This is more of a Chinese medicine practice, but moxibustion can be really wonderful for helping to bring warmth and healing and blood flow into the areas to enhance tissue healing and formation. Typically, you'd want to wait until the person at least 6 to 8 weeks postpartum after a C-section. It could potentially be longer. So those are some things that are really beneficial for helping to support the overall health and well-being of the person's abdomen and uterus and reproductive organs. So like I mentioned earlier, because of the nature of cesarean births, there is an increase in waste products or like toxins in the body from medications that are administered, as well as just like normal metabolic waste that happens from pregnancy, labor, and surgery and pain management. Because somebody who experiences a C-section is more likely to have constipation and reduced digestive capacity and potentially greater risk of AMA formation, there's also that metabolic waste that builds up potentially from the digestive system not functioning as well. They also might have an increased risk of edema, fluid retention, reduced lymphatic flow due to incapacity, so not moving as much as they were used to moving, and or just not being comfortable to move in the same way that they had moved before. And that kind of impaction on the body can impact the breast milk flow. So part of our support for the postpartum birthers, part of maintaining strong digestion, strong Agni, and ensuring that they're eliminating regularly and providing the right building blocks for the healing of their body is to kind of clear the channels out. So if they're eliminating regularly, if they're drinking enough warm fluids and they're peeing regularly and they're pooping regularly, and their feces is not really hard, there is a greater capacity for their body to eliminate waste products. If they're sweating normally also, that's also one of the ways that we release waste products through our body. So whether that's taking a nice hot shower or a nice hot bath or using some form of like a steam to cause and induce sweating, that's one of the ways that we can support the channels being cleared in their bodies. That's one way we can support the metabolic waste leaving their bodies. And this is incredibly important for all birthers, but especially after having a C-section. Now, one of the things that I found in my practice is I have a steamy wonder, which is basically like a steam tent that I put onto the massage table after doing the Abhyanga, and like herbalized steam gets pumped up through the bottom, and it like steams, it's like a one-person sauna with their head sticking out. And what I found with my cesarean birth clients, even if it's a month after they've had their babies, that they receive an Abhyanga and do the steam, that steam is one of the most beneficial things that they experience. So they can feel this, like the deep penetration of the heat into their body, and also the release of the metabolic waste from their system in the process of receiving that steam. Moxibustion can do a similar thing. It's more localized, but the steamy wonder tent, or like a kind of an individualized steam therapeutic experience, helps to facilitate the full body flushing, and it helps to regulate body temperature, and it helps to regulate the overall flow of the lymphatic fluids through the body. One of the things that I found for myself, because I had a lot of edema from having a lot of IV fluids in the process of labor and birth, was that my breast milk came in on day 2 or day 3. Yeah, day 3. So my breasts were really engorged, but the breast milk was not moving. It was stuck. So even though my son was nursing and he had a great latch, the milk literally would not come out. And so one of the things that can be beneficial is, of course, to continue to do all of the things to get the channels cleared, with drinking and eating warm foods. But another thing that can be helpful is Byronia homeopathic remedy. And so that is effective at helping to remove the stagnation, or to move the stagnation of the milk in the lymphatic system. In addition to that, increasing the pungent flavor. So increasing additional black pepper, additional ginger, even like a little bit of cayenne into the person's food can help to induce sweating and also move the lymphatic fluid. and move the breast milk. So Sushruta, in the Sushruta Samhita, which Sushruta is one of the main classical authors of Ayurvedic texts, and his focus, his sampradaya or his school of thought was focused on specifically surgery. And so he has specific protocols for what should happen before, during, and after therapeutic management, but specifically surgery. So his recommendation is to eat light, easy to digest food in small quantities at regular times, and to slowly increase the density of rice gruel. So manda, peya, and valepi is a kind of stages of rice gruel that is typically followed or typically utilized following panchakarma and or following like surgical procedures. And manda is like rice water, essentially. Peya is like a very, 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 very thin rice gruel, and valepe is like more of like a gruel. And what's recommended is to actually have these kind of components in this like rice gruel in some kind of a bone broth. So in the broth of the meat of animals, or the bones of animals. And so typically it's recommended to first have, of course, freshly prepared foods. Aged rice is the ideal component of the manda, peya, valepi, which is rice that has been harvested and then sits for ideally like 5 years or more. It's going to be lighter and easier to digest than freshly harvested rice, which will have more water in it and be a little bit harder to digest. And actually the carbohydrate composition is a little bit different with aged rice than with freshly harvested rice. The aged rice is less likely to cause a blood sugar spike than freshly harvested rice. In addition to aged rice, ghee, bone broth, and then mung dal, tender vegetables, pomegranate, amalaki, or oranges are recommended. It's generally recommended to avoid black gram, which like anything that's harder to digest and more dry, sesame oil, fasting, eating large quantities of food, incompatible food combinations, hard to digest food, and food that is dry, cold, or heavy. So the wound healing process happens in 3 stages. And the first stage is inflammation, redness, swelling, and pain. This is where the damaged tissues are being destroyed. And so someone that experiences a cesarean can literally see the stages of this wound healing process where their incision is very like tender and very red, and there might be some little like seeping that happens. So this is step 1, where we see that inflammation and separation happening. And then step 2 is the proliferation phase, which is the rebuilding of connective tissue. And it's the process, the initial process of wound healing. So it's kind of like the connective tissue coming together. And this is why it's so imperative that the person has adequate protein intake, and specifically adequate like animal protein intake, because of the amino acid composition, and how easy it is to digest and how readily available it is in the form of bone broth or collagen. So those amino acids are the building blocks for the tissue repair and tissue formation. So for the proliferation phase and the regeneration phase. And the regeneration phase in the context of a cesarean is going to last for at least 8 weeks and typically longer. Like, I don't know about other people who have experienced a cesarean, but I felt like it really took a full year for my body to feel like I couldn't, like the scar tissue wasn't as big. It like kind of finally went down a bit. Like I could feel the ropes underneath my scar for a long period of time, but it was after a year that it started to like kind of like diminish. And so I feel like the process of really nourishing our bodies, having bone broths, having like collagen, is really imperative, not just for the first 6 to 8 weeks postpartum, but for the duration of the nursing period of time. That's for as long as the birther is breastfeeding their child, their baby, and or until their body, like their scar tissue, feels like it is healed and the sensitivity to the area is no longer as strong. Generally, in regards to cooking and food post-cesarean, we would want to start with light, easy to digest food that's well spiced, and gradually increase complexity over time, so that maybe by the 6 or 8 weeks of their postpartum, they are starting to eat foods that are more similar to foods that they had prior to having a cesarean. But we'd really want to make sure that their agni is strong enough to digest any additional complexity along the way. And that recommendation goes across the board for all birthers, but it's especially important for somebody who's experienced a cesarean for all of the reasons that we discussed, for the increased like toxin load in their body and the impaired digestion and the increased vata that's just more prevalent when there is tissue damage and kind of trauma to the tissues, as well as the cold environment of the OB operating room.
I have a question, Ashley.
Yeah.
Well, first I want to say that was so amazing and detailed. I'm like really have been enjoying how detailed and thorough this has been. And I'm actually curious if you know when cesarean births started happening, and also if you happen to know like when that switched to not necessarily using general anesthesia. I feel like that was relatively recent, but I was just wondering if you happen to know those things to just give a little bit of context.
Yeah, it's a great question. I actually don't know. I know that cesareans have been practiced for a very long period of time, but typically they were the last resort to save the baby, and oftentimes the birther, the mother, died historically. But they, since we've had modern surgical technology, then the likelihood of maternal death is much less. Sushruta Samhita actually discusses how to do cesarean in his text, and his text was written, anywhere like 5,000 years ago. I think that he had more awareness of, I think he had actually a good amount of tools at his fingertips to have patients that went through surgical procedures and came out alive, versus some other potentially like cultures that didn't have as developed of a science or like system in place. But I don't know specifically when they started. And then I also don't know when general anesthesia stopped being used, but I was born in 1984 and my mom had a C-section for me, and she had a spinal. So meaning that she wasn't under general anesthesia and she was awake when I was born. So at least in the 80s.
Okay, that's cool to know. Yeah, I was thinking, I was born in the 80s, and so was my brother and some of my cousins, and we were all C-section babies. And I know that my mom was under general anesthesia, and I don't actually, now that I think about it, maybe she did mention that they tried to do the spinal option, but there was something about her body that wasn't working. But thanks for exploring that with me.
Yeah, totally. I'll look that up for my own knowledge. I'll send it along to you.
Thank you.
Ashley, Sumia has a question. She asks, what is a normal amount of oozing from incision site? Can you please share what to be alarmed of from incision postpartum?
Yeah, so a normal amount of oozing is like this kind of sebum fluids, right? Like the kind of like clear orange fluids until the incision site heals, which again, the incision site, if the person is healthy and has like healthy tissues and has a diet that is supportive to, essentially they're eating like bone broth and having some animal proteins, which provides amino acids, their incision actually heals within like 5 days. Like not fully heals, but like this comes together and it's not going to be oozing anymore. Now, if the incision starts to be really red and poofy and it's not getting better, it's just getting more red and poofy, and it's starting to either smell weird, or it's oozing pus, like it's oozing like a yellowish, cloudy fluids, then that is something to be alarmed about. Also, if the amount of pain that the person is experiencing is, if the tenderness that's present is more than one would, how can I describe this? If the person is taking their pain medication and they're still experiencing a lot of pain, they should definitely have their incision looked at. And or if they're just unsure about what's happening with their incision, then they should have their incision looked at. But typically just like a little bit of that kind of sebum oozing is normal until the incision closes. So anything beyond that, and or if it's not getting better, then that's something to be concerned about.
I have a question.
Yeah.
So when I had a cesarean, I didn't take off the wrapping because I was afraid to. Is there a certain day in which they should remove it so that they can start to air it out and let it heal a little better?
I think it depends upon the wound healing philosophy. Like there are some perspectives that like putting a bandage over the incision or the trauma to the tissue and letting it be there until the bandage falls off, like which could be 5 or 7 days, that kind of allowing that moisture can help the wound to heal better. But I think that I haven't read a specific amount of time, like days, but I know for my own cesarean that within, like when I went home, so day 3, they had removed the bandage and then they took the staples out and then I just had steri strips over it. So starting on day 3, I just had steri strips instead of a full bandage over it.
Okay, because they left mine on and then I went for my post-op visit and they were like, why didn't you take it off? You were at risk for infection by leaving it on. And I'm like, I had no idea. I'm sorry.
I felt like that was one of the most disappointing things about having a cesarean. It's like they have so much information. You get like this huge packet of like information on, you know, baby care and stuff like that. But I feel like their explanation of cesarean recovery was like really, really poor. Right. Like they don't tell you about the gas pains, right? They don't tell you about like things that would be really helpful for like making sure that there's someone to help you sit up in bed, like those really basic things that make a huge difference to somebody actually recovering well.
I agree.
Yeah. It's awesome you're a doula so you can help other people to go through that.
You know what was so crazy? So this was my second cesarean and this one was planned, so it was a very different experience. But speaking to the gas pains, it was such a funny thing because I knew that and it happened in my first with my daughter, but not everyone knew about it. So like when I was talking about like how I have this pain in my chest, some of the doctors were like, have you felt that before? I'm like, don't you guys like don't you experience this, you know? But a couple of them did. So anyways, it was so with the knowledge that I have now, I'm like, well, how come you guys don't? And that's a rabbit hole, but anyways, it's just like these little things. So thank you for putting on such a beautiful presentation with this.
Yeah, totally. Congratulations, Miranda. It's good to see you. You know, I didn't actually know about the gas pains until a friend of mine had a cesarean, and she was the one that told me about it because she ended up going to the hospital concerned that she was having heart problems because where the pain was on her left side was like where her heart was. And so she was worried that she was like having a heart attack. And they're like, oh no, that's normal. And she's like, why would you not tell me? So then now with every person that's had a cesarean, I've been like, you will probably experience gas pains that might feel like you're having a heart attack. And it's probably not a heart attack. It's probably just these gas pains. So yeah, the more that we can kind of spread that. Yeah.
Right.
That's
exactly what happened the first time is I ended up going to the emergency room because I didn't know about it. And I thought I was having like some kind of heart failure or something. But yeah, so it's definitely something I now share with all my clients too.
That's awesome. Yeah.
I have one last question.
Yeah.
I was wondering, for all the mamas and the clients that you guys have worked with, as far as the trauma from emergency C-sections and having to have a C-section when that wasn't planned, what resources or support that you recommend that really could help process the journey that they went on, and focusing on how to be present with baby rather than stuck in the sadness of that process?
Yeah, Charlotte put in ICANN has support groups everywhere. Yeah, that's fantastic. I also like, personally, I feel like it has been a process of unfolding over the past 2 years. My son's 2 now. And I'm now at a place where I'm like looking at it in a different way and able to kind of see the trauma that was there and also step back a little bit from it. And so part of it, I think, is time. And I also think that part of it is like birth listening, like listening to the story and like honoring the grief that is present, because that is important to do. I think that flower essences are really supportive and helpful for doing some of that deeper work. And then I also think that doing journaling and working it out mentally, sharing their story, and then also beginning to do the work on their body plays a huge role. Because while I personally had been doing some scar tissue massage, I was just doing the superficial scar tissue massage up until about a year ago, or a couple months ago, actually. I went deeper. And the deeper that I went, the more I was becoming aware of things that I'm holding in my tissues that I wasn't processing. And so part of it is like the integral experience.
Yeah, I think there's so many different ways that people process trauma or can access healing from a traumatic birth. And so I really encourage, as caregivers, I think we have an opportunity to sort of open up conversations and sort of ask important questions and give people an opportunity to share stories. And and I think sort of giving permission for the person to ask the question of themselves, like, what is the best way for me to sort of uncover layers of healing that need to happen? Because I just think each one of us is going to have a little bit of a different journey. But I really like the sort of, combining, the heart with the voice, with the body, like accessing different, the different, it's just a whole path, a whole approach.
Mm-hmm. I also think that like having like just the general reflection of the rite of passage of parenthood is so lacking in our culture, but also having the reflection of how we as postpartum caregivers can reflect the transition and transformation that the birther has gone through, however their birth ended up happening, like seeing that journey as like kind of the hero's journey of going through the trials and tribulations, and like honoring the trials and tribulations, but also honoring this next phase that they're stepping into, which is so important. And that like that stepping into that phase and stepping into that greater responsibility that we step into when we become parents, like part of that is resolving the challenges that arose in the journey and finding mining for the strengths that we are pulling out of that. So however their birth ended up happening, they went through that hard, challenging experience, and they are strong because they've survived. And so mining for those little pearls, I think, can be helpful to kind of not put a positive spin on it, but just to be like, yes, like that was so hard, and here you are. How can we build up our clients even through those hard moments of time, so that they are more resilient having gone through whatever experience they've gone through. And also potentially referring them to like birth listener people that have gone through, like Pam England has a really powerful birth listening program where people learn how to listen to births and help people to process. So like referring them to somebody that has that training or doing that training, or referring them to a kind of a spiritual elder that can support them in walking through that rite of passage in a way that's supportive to their bodies and to their souls.
I just wanted to chime in really quickly, sort of piggyback off what you said. So for me personally, I had a very traumatic experience with my cesarean. And like we talked about anesthesia, I went from having local anesthesia to them administering general anesthesia because I was screaming because I felt everything they were doing to me. Oof. So when I first realized that I could feel them, I told them, I said, I can feel that. They weren't very sure that I knew what I was talking about. They're like, oh, maybe it's just pressure. I'm like, no, I feel pain. And I became very hysterical. And all I remember was them saying, put her to sleep. And then I was waking up to my baby being shown to me. So that was not the ideal birth. But I feel like some other doulas like myself, we end up getting into this work because of our experience, and had it not been for my childbirth, I probably wouldn't be a doula today. But I just feel like I can help other moms avoid such an experience and help them advocate for themselves. And then the whole recovery process. I didn't know about the gas situation. I didn't know that they'll make you have a bowel movement before you leave the hospital. So those things, you know, I had to warn my client. She's actually in labor now. I had to warn her, like, you know, you're going to have to move your bowels and you will have pretty bad gas, but just do a little light walking around your room and it'll help get it going, because I had a really hard time using the bathroom simply because I was afraid. You know, that was major abdominal surgery, so I was terrified to even go number one. So I think that experience will give me the upper hand for sure. And part of my healing process is being a doula. So being there for other women and helping prepare them mentally and emotionally definitely gives me closure to what I consider a bad experience.
Yeah. Wow. Jocelyn, man, oh gosh, I feel for you. I cannot even imagine how intense that must have been. And it's awesome that you're able to find that pearl and to support women and to be able to, like, I feel like for all of us, like doing this work and providing the information, the education that we can provide to our clients based upon our experiences or based upon what we know, that we, over time, there's going to be enough people, hopefully, that talk to their primary care providers or OBs that then start to shift how they communicate and how they work with people, because like we are human beings, right? We need respect and we need compassion and we need to be listened to, because we are the only person that can feel what's happening in our bodies. And yeah, so I just thank you so much for sharing, Jocelyn. Thank you for doing the work that you're doing.
Thank you.
Well, I think we are at time. I love talking about birth stuff, so I'm happy to field like questions via email anytime at ashlee.sacredwindowcenter@gmail.com. Thank you all for being here, and thank you for doing your work in the world.
Yeah. Ashlee, thank you so much for this beautiful talk. Thanks to all of you for coming. I will send you, Nina and I will put together follow-up for you with all the information, including how to get in touch with Ashlee and the recording for today. Again, if you are not a member of the Postpartum Care Collective,
We will send you a link to learn more about that and how you can come to these talks regularly for free. Thank you all, and we wish you all a beautiful rest of your day. And again, like Ashlee said, all the great work you're doing in the world is so important, and we're happy to be in company with you.
Shanti, Shanti.
The Center for Sacred Window Studies has been training postpartum care providers, professionals who work with new families, and individuals passionate about postpartum care since 2018. We regularly host live free events alongside our online and in-person training and certification programs. Hop on our newsletter list to get direct access to all of our events and community support gatherings. Our mission is not only in training conscious postpartum care providers, but in fostering a robust, informed, and thriving community of postpartum professionals. Once you step inside, you're family forever. Visit www.sacredwindowstudies.com to add your email to our newsletter list. You can support our work by subscribing to the Sacred Window podcast and sharing with someone you know who would love it. Thanks for being here and participating in the culture-wide shift that recognizes the need for and the importance of conscious postpartum care.